An urgent alert tonight involving children. We told you about a mysterious rare syndrome sickening children in both New York and in some places in Europe that appears to be connected to COVID-19.
Tonight, Children's Hospital of Michigan is warning this syndrome is impacting children right here as well. So let's get right out to our Dr. Frank McGeorge with the very latest. Doc?
Yeah, Karen and Devin, the chief medical officer at Children's Hospital sent a letter to doctors in Michigan warning them to be on the lookout for this syndrome. But he wants parents to be on guard as well because the symptoms can be very typical of other childhood illnesses, but this can quickly progress to a life-threatening situation.
It is rare, but it is here. I mean, we're absolutely seeing it.
It's being called Pediatric Multisystem Inflammatory Syndrome. Dr. Rudolph Valentini says Children's Hospital has seen 15 to 20 cases, all in the last 2 weeks.
We have several in the ICU right now, and we have several in our hospital right now.
Some have been so sick they required a lung bypass machine called ECMO.
They were on the verge of cardiac arrest. It's that advanced level of heart dysfunction.
The symptoms in younger children include fever lasting at least 2 days, a rash, red or peeling palms or soles, red and cracked lips, and red inflamed eyes. Children may also have a strawberry red tongue. Older children and teens tend to have more subtle symptoms, including a fever lasting more than 48 hours, along with a rash or gastrointestinal symptoms like abdominal pain or diarrhea.
We believe that this is an association with COVID. Some of our patients are actually COVID positive. Some have been COVID exposed and test COVID negative when they get here. Ultimately, this is going to require some additional investigation to try to link it to COVID.
The rash tends to be red and blotchy, showing up on the cheeks, legs, or arms, but it has also appeared as little dots.
It can get serious very quickly, like within hours. If the child is not right, they have fever and they're just not right. If they have any of these other symptoms, please call your pediatrician. If you can't reach your pediatrician, you can't be seen by a doctor, go to your local emergency room, preferably one with expertise with children.
Yeah, and cases have been seen in babies as well as all the way up to teenagers. Now, there has been one reported death, but that was a 14-year-old boy in London. Dr. Valentini stresses that doctors can treat this effectively if parents seek help quickly, but we know many are reluctant to take their children to an emergency room right now, so it's really important to spread the word about this.
One of the few positives about this virus, if there's such a thing, Doc, was that it seemed to cause little to no symptoms in children. We thought for so long. Is that changing?
Well, you know, Devin, this is newly identified, so it's not clear how many kids have been affected. It does seem to be rare, fortunately, but Dr. Valentini says if this is proven to be COVID connected, then yes, this would be a substantial change. Back to you.
Yeah. All right, Frank. Karen.
Detroit Mayor